I myself have been sworn at. I've had things thrown at me. I've been spit at. I've had people try to swing at me and kick me.
Welcome to the Built on Results podcast, a series of conversations about the issues, the advocacy, and the wins on behalf of emergency physicians. Dr. Amanda Irish is an academic physician in the emergency department at the University of Iowa Healthcare System in Iowa City, Iowa. She says policymakers often have no idea about the violence that emergency physicians and others are confronted with when they go to work each day. This is episode 11, The New Normal.
I'm very lucky to practice in a suburban community, and we don't experience this probably not every day. There are episodes of it. We've had some very distressing and dangerous situations happen in our quiet suburban emergency department. I can tell you I've also trained in other settings in Hartford, Connecticut at more of a county type hospital. I also trained in a larger city in South Carolina, and there were more frequent encounters with violence in the emergency department. I myself have been sworn at. I've had things thrown at me. I've been spit at. I've had people try to swing at me and kick me. I know of nurses and physicians who've been punched, lost teeth, needed to have bones repaired, needed extended leaves of absence and hospitalizations. And this is just, in my social circle, getting into the statistics, we know greater than 90% of emergency physicians experience some kind of violence in their departments. And so while there's a lot of variability, it's really almost a universal experience for us.
Were you prepared for these attacks? And also, have you seen violence increase over time?
Well, I was just getting into the emergency department when COVID took hold. And I can tell you it felt like things really accelerated during kind of those middle and later phases of COVID. Early on, when people weren't coming into the department at all, we didn't see a lot of ED violence, but something changed in society. And I think most people recognize that. We're all a little bit more on edge and a little bit less well-behaved, I think, just universally, even outside of the emergency department. So certainly something has shifted in that regard. And some of this too comes from not just my personal experience, but talking with my attendings as I'm learning from them about, how to manage these patient behaviors. We've all had to adjust to what is now considered the new normal. There have always been instances of folks in the emergency department behaving badly, and whether that was for reasons related to toxidromes or substance abuse or just overt aggression. I think we're seeing more cases now of just kind of ill manners and folks who just can't, verbalize frustration with the situation. So they lash out in a way that's often physically violent.
Is it any easier to deal with the longer you've been around it? And also, how does it impact your attendings?
There's a couple different ways to answer that. So first, I think it is really hard on the trainees because they're still very optimistic, I think, about the ideals that got us into medicine, and they really wanna help people. I think for me, I'm in a place now where it does feel like expected territory. The flip side of that is it makes it hard for me to be compassionate in my day-to-day role because of that exterior that allows me to deal with these episodes of violence. I can't be this, emotionally available, connected physician because, I've got my dukes up, so to speak. I'm ready for the other shoe to drop. And so I think that separates me from the patients. And I think that makes the teaching environment really challenging for those young learners to try to balance the compassion that the job really requires to serve people well with, you know, defending yourself physically, having a body awareness of where you are in space. Those things don't really fit together. So, you know, I'm teaching my caregivers to have a protective stance as if they were law enforcement. It's just, it's very much a paradigm shift.
ACEP has been working diligently to pass the Save Healthcare Workers Act, but the question really is, why isn't this a no-brainer?
You know, on a piece of paper, I think people can assume that it's not really a problem or that, you know, this is unnecessary legislation. But, you know, when you look at kind of the body of evidence that ACEP has compiled, hundreds of stories, you know, that statistic of 91% have been threatened or know someone who has. I just don't know that that is filtering through and getting to our decision makers. I know this has been something that ACEP has been campaigning on for years, for at least 3 years that we've taken this to the Hill. We've built up a bipartisan following, but it still seems to be really more focused among folks that have a medical background in Congress. You know, I think people worry about the nuance, and I won't lie, I worry about the nuance too, as we've already talked about here. You know, there is a difference between somebody who is aggressive for no cause, and then, you know, the classic example we always get about, you know, what about an elderly individual who is delirious or demented, has a urinary tract infection is like our common example. Are we criminalizing that activity? And how do we differentiate that? How is that sorted out kind of on the legislative or enforcement angle? I don't think this is beyond our capability. I think that we can draft legislation that allows for consideration, but also sets a standard that, you know, we are here to provide healthcare services, not to be a punching bag for folks that are frustrated.
You attend ACEP's Leadership and Advocacy Conference every spring. In fact, it's coming up this April again. We'll have a link to sign up for that in the show notes. That's a real opportunity to share these stories of what's happening every day on the front lines, right?
Absolutely. You know, even in my family, I'll tell stories about things that happen in my, you know, work nights. I'm primarily a nocturnist, and, you know, folks see TV, they watch Scrubs, they watch The Pit, and thank goodness for The Pit really opening some folks' eyes as to what the ground looks like, because it's more The Pit than it is Scrubs, and it's more that than it is Grey's Anatomy or ER or anything else. But people just don't know what we're going through. And because, you know, we bite the bullet and we take it as it comes, we're not complainers, we're doers, and we're really great at that. But this is our opportunity to get out and tell folks, you know, what it's like, and that speaking out for better working conditions doesn't make us complainers and it doesn't make us victims. It allows us to speak up about what our needs are so that we can provide excellent patient care for the breadth of those folks who come to us in need.
Finally, what do you think it'll take to make EDs safer for the people who work there?
That's a tough one. To make emergency departments safer is going to require a joint effort across the board, Republicans, Democrats, independents, folks that work in emergency medicine, and without being united in the belief that individuals who are providing healthcare services are there to serve and must be protected from violence. It really shouldn't be any more complicated than that.
Every day from now until March 28th, we'll feature a different story about the work of ACEP and its chapters. We'll talk about advocacy wins and work still underway to make sure you can do your job. We kicked off the series on March 11th. You can listen to those conversations and read more about ACEP's work to address violence in the ED by clicking the links in the show notes. There's also a website, acep.org/results. You've been listening to the Built on Results podcast, a production of the American College of Emergency Physicians. We're back tomorrow. Until then, have a great day.